I often get asked how we can know if the patient is improving on non-invasive ventilation versus tiring. In both of these situations, the respiratory rate is going to drop. But that drop in respiratory rate has very different implications based on whether you think the patient's tiring or getting better. In the tiring patient, the drop in respiratory rate means that you should be moving towards intubation. In the patient who's improving, the drop in respiratory rate means that your intervention is working and you should keep going forward. Following the patient's clinical status can be very powerful. If the patient is more awake, if they're more alert, then the non-invasive is doing its job. Another great marker is to follow the tidal volume. If the respiratory rate and the tidal volume are dropping, the patient is tiring out and they're going to need to progress to intubation. On the other hand, if the respiratory rate is dropping, but the tidal volume is improving or staying the same, that's a good marker that your intervention is doing the job. The patient's breathing slower, but they're pulling good tidal volumes. And this is an easy parameter to check because the machine tells you what tidal volume the patient's taking. So make a note of that initial tidal volume and then continue to follow that parameter as you treat the patient to see if your non-invasive is working.